हेलो डियर स्टूडेंट, आज हम इस वीडियो में डिस्कस करने वाले हैं रिगार्डिंग पेशेंट मेडिकेशन हिस्ट्री इंटरव्यू इन द सब्जेक्ट फार्मेसी प्रैक्टिस BP 703 TT. So before patient medication history interview, we need to study about the medication review. What is medication review? Medication review, it involves the review of a patient's medication regimen to ensure that therapy is appropriate, safe, efficacious and cost effective or not. That means in medication review हम यहाँ पे ये देख रहे हैं कि whatever the medication that has been prescribed to the patient, so are they appropriate, मतलब सही हमने medication दिया है या नहीं, are they safe or effective, and also we need to consider about the cost also. So this is about the medication review. So यहाँ पे before starting about the history about the patient medication history, we need to study about the medication review. मतलब हमने सही जो भी medication दी है तो वो proper है या नहीं, that we need to check. This can be achieved by pharmacists attending ward round on a day-to-day basis and applying their knowledge of therapeutics in the management of specific disease or condition. मतलब यहाँ पे क्या है कि जो भी फार्मासिस्ट है, मतलब हम अगर कोई हॉस्पिटल के अंदर हम कंसीडर कर रहे हैं तो फार्मासिस्ट है, he has to go to the ward and he has to do the proper round and he can ask to the patient about the history and about also the medication that has been given to the patient. So by this way only the pharmacist, he can play the important role when we are considering about the medication review. एंड ऑल्सो यहाँ पे जो भी कोई डिसीज हुई है, कोई पेशेंट अगर ही इज सफरिंग फ्रॉम स्पेसिफिक डिसीज, सो फार्मासिस्ट he has to attend, he has to go to the ward and he can ask to the patient about the treatment of particular disease. और उसके ऊपर से पता चल सकता है कि whatever the medication we have given to the patient, that is appropriate, safe, efficacious and also the cost effective or not. So this is about the medication review. Now what is the goal of medication review? गोल क्या है? The goal of medication review is to optimize drug therapy. मतलब यहाँ पे हमें जो भी ड्रग हम दे रहे हैं उनको ऑप्टिमाइज करना है, and also the patient health outcome by identifying and solving drug related problems if the patient he is having any drug related problems, and also ensuring that all therapeutic objectives are being achieved or not. मतलब यहाँ पे मेडिकेशन रिव्यू जो भी अगर फार्मासिस्ट कर रहे हैं तो उनका सबसे इम्पोर्टेंट गोल ये है कि व्हाटएवर द ड्रग वी आर गिविंग द ऑप्टिमाइज्ड ड्रग थेरेपी और नॉट, एंड वी नीड टू चेक अबाउट द और वी नीड टू सॉल्व अबाउट द ड्रग रिलेटेड प्रॉब्लम, एंड ऑल्सो वी नीड टू डू अबाउट द थेरेपी, वी नीड टू अचीव द थेरापेटिक ऑब्जेक्टिव ऑफ द पर्टिकुलर थेरेपी. सो यहाँ पे फार्मासिस्ट जो भी हिस्ट्री या फिर जो भी इंटरव्यू ले सकते हैं, अगर फार्मासी डायरेक्टली इफ ही इज टेकिंग द इंटरव्यू ऑफ द पेशेंट, देन ऑन द बेसिस ऑफ दैट वी कैन अंडरस्टैंड दिस थिंग्स. सो दिस इज द गोल ऑफ मेडिकेशन रिव्यू. देन सिग्निफिकेंस ऑफ मेडिकेशन रिव्यू to assess whether desired therapeutic outcomes are being achieved or not. Then to monitor for drug related problem, अगर ड्रग के रिलेटेड कोई प्रॉब्लम या फिर टॉक्सिसिटी आ रही है, so that can be identified by the medication review. मतलब कोई ड्रग अगर हमने पेशेंट को दी है और then afterwards if he is having the problem related them, or if the drug it is giving any type of toxicity or it produces the toxic effect to the patient, then we can understand from the medication review about this. Then ensure rational and quality use of medicine, assess patient compliance, मेडिकेशन एड्यूरेंस. देखिए मेडिकेशन एड्यूरेंस लास्ट लेक्चर में हमने ये डिस्कस किया था मेडिकेशन एड्यूरेंस. तो यहाँ पे अगेन वी कैन असेस अबाउट द पेशेंट कंप्लायंस एंड एज वेल एज मेडिकेशन एड्यूरेंस, मतलब व्हाटएवर द ड्रग वी हैव गिवन टू द पेशेंट, वेदर ही इज टेकिंग प्रॉपर्ली और नॉट. तो यहाँ पे ये चीज भी हमें देखनी है कि भाई जो भी पेशेंट है तो प्रॉपर्ली मेडिसिन ले रहा है नहीं ले रहा. Then assess the completeness of medication chart. That means we need to study over here the medication chart also. That means we from the medication chart we come to know whether the patient he is taking the medicine properly or not. तो मेडिकेशन चार्ट भी रिव्यू कर सकते हैं. तो we can do this all the things, or we can obtain, these are the significance we can say of the medication review. और मतलब हम बोल सकते हैं कि मेडिकेशन रिव्यू के ऊपर से ये सब हमें चीज पता चल जाएगी. देन मेडिकेशन ऑर्डर रिव्यू. देखिए मेडिकेशन, जो भी मेडिकेशन हम प्रिस्क्राइब कर रहे हैं, so we need to review that one. So what is the medication order review? It is one of the fundamental responsibility of clinical pharmacy practice, as it is the basis for other clinical pharmacy activities. Other clinical pharmacy activities क्या है? Such as medication counseling, then therapeutic drug monitoring, that means TDM, and also detection and management of ADRs, that means adverse drug reaction. तो मेडिकेशन ऑर्डर रिव्यू, इसके ऊपर से हमें क्या पता चलेगा? Mainly we can say this is the responsibility of the clinical pharmacy practice, and we can say the pharmacist, he can identify this, and on the basis of this we can identify other activities such as the medication counseling, and also we can understand about the TDM and any adverse drug reaction that is happen to the any medicine. So this is the medication order review. Now MOR is the systemic review of a patient drug therapy to ensure that a prescribed medication is appropriate for the patient or not. तो यहाँ पे हम क्या कर रहे हैं कि जो भी हमने ड्रग थेरापी दी है, देखिए यहाँ पे टीबी के केस, अगर टीबी को पेशेंट है कोई, तो प्रॉपर ड्रग थेरापी, दैट इज वेरी मच इम्पोर्टेंट. रिसेंटली अभी जो भी कोरोना डिसीज है, तो कोरोना डिसीज के लिए भी प्रॉपर ट्रीटमेंट है, वो बहुत इंपॉर्टेंट है. सो likewise, whatever the drug therapy that we are giving, that is appropriate for the particular patient or not, that we need to check. It involves the assessment of all current and recent medication order, whatever the prescription that has been given to the patient, that we need to identify, including routine medication and over the counter. That means यहाँ पे बहुत बार ऐसा भी होता है कि कोई पेशेंट अगर OTC प्रोडक्ट कोई ले रहा है, तो we need to identify about the OTC product also, and the use of other systems of medicine. That means कई बार ऐसा होता है, कोई पेशेंट है, तो if he is taking or the allopathic drug has been prescribed, then same time he is taking the any Ayurvedic product also. So other system we need to identify about the Unani system, Ayurvedic system, and Siddha system product, any drug whether the patient is taking or not. So here we need to identify about this also. So medication order review मतलब क्या है कि we are doing one of the assessment whether the patient he is taking any other product or not. क्योंकि कई बार ऐसा होता है कि हम प्रॉपर ट्रीटमेंट अगर हम दे रहे हैं, या फिर जो भी ड्रग थेरापी हम दे रहे हैं, उनकी इफेक्ट नहीं आ रही है, because patient is taking some other OTC product which is contrary to our product or whatever the product we have given. So that's why we need to identify, or we need to do assessment about the OTC and other system of medicine if the patient he is taking or not. So medication order review, it includes such a things. Then goal of medication order review. The goal of medication order review is to optimize the patient's drug therapy by ensuring that patients receive the right drug, right dose and dosage form for the right duration. मतलब जो भी हमने अगर डिसाइड किया है कि भाई इतने ड्यूरेशन के लिए ये लेना है 5 दिन के लिए, तो if whether he is taking for 5 days or not. So this is the main goal, or by this MOR we are optimizing that patient is taking whatever the drug that has been given to the patient, whether he is taking properly or not, that we need to identify. Then the steps involved in MOR. First one, that is collection and interpretation of patient specific information, that including medication history interview. That means medication history interview, that is one of the part of MOR. We can say it is the part of MOR. Then assessment of therapeutic goal, identification of drug related problems, then individualizing medication regimen. Medication regimen जो भी हम दे रहे हैं, तो उसके बारे में we need to do the study. Then monitoring of treatment outcome, whatever the outcome that has been received, then we have to monitor that. Then medication chart endorsement, that means we need to study and we need to identify the medication chart and documentation. So these are the steps that is involved in medication order review. Out of this, in our syllabus, there is a medication history interview, that means MHI, that we will study over here. So medication history interview, MHI. Medication history, it is a detailed, accurate and complete account of all prescribed and non-prescribed medication. देखिए यहाँ पे क्लियर लिखा है prescribed and non-prescribed. बहुत बार हम हिस्ट्री अगर हमें देख रहे हैं तो whatever the drug has been prescribed, that we are detecting, but whatever the non-prescribed drug, that we are not considering it. But over here in medication history, we need to have a detail about the prescribed and non-prescribed medication that a patient had taken or is currently taking prior to a initially institutionalized और एम्बुलेटरी केयर. दैट मीन्स जब भी पेशेंट अगर कोई हॉस्पिटल में आ रहा है तो हॉस्पिटलाइज होने से पहले उन्होंने जो भी ट्रीटमेंट ली है या फिर जो भी मेडिसिन लिया है, दैट शुड बी इंक्लूडेड इनटू अ मेडिकेशन हिस्ट्री इंटरव्यू. नाउ इंटरव्यूइंग अ पेशेंट इन कलेक्टिंग द डेटा मेडिकल हिस्ट्री इज कॉल्ड मेडिकेशन हिस्ट्री इंटरव्यू. मतलब जो भी हम इंटरव्यू ले रहे हैं, यहाँ पे हमें पेशेंट का पूरा इंटरव्यू लेना है कि भाई कौन सी मेडिसिन पहले उन्होंने ली है, कौन कौन सी ट्रीटमेंट ली है. सो दैट इज कॉल्ड एज अ मेडिकेशन हिस्ट्री इंटरव्यू. एंड very calmly we need to ask this all the information to the patient, and this is known as a medication history interview. Medication history, it provides valuable insight into a patient's allergic tendency. That means it gives very accurate information or in-depth information about the allergic tendency, then adherence to pharmacological and non-pharmacological treatments, and also about the self-medication with complementary and alternative medicine. That means यहाँ पे पूरी हिस्ट्री या फिर पूरी चीज हमें पता चल सकती है, whether the patient he is allergic to any product, allergic to any drug, and adherence to the particular product. Then self-medication, if he is taking any other product, then we can identify, we can understand about the self-medication also, and whether if the patient he is taking any alternative medicine, then also we can have the information about this. Then collection of patient specific information, we can say it is the first step in setting the therapeutic goal of a patient. Pharmacist over here, you need to collect information that will assist them to determine the appropriateness of drug therapy. मतलब यहाँ पे जो भी information collect करनी है, that should be done by the pharmacist only. Pharmacist he will determine the appropriateness of the drug therapy. Then when a patient is admitted to a hospital, तो ये इंटरव्यू हम कहाँ पे या फिर इसकी नीड क्या है? When a patient is admitted to hospital, medical staff document relevant information regarding the admission in the patient case note. मतलब पेशेंट का जो भी केस नोट रहेगा उसमें जो भी इम्पोर्टेंट चीज है, इनिशियली व्हेन द पेशेंट ही इज एडमिटेड टू द हॉस्पिटल, तो इनिशियली जो भी मेडिकल स्टाफ रहेगा he will ask about the information, relevant information, and he will note it down into the case notes. Usually it includes list of medication which the patient is currently taking. मतलब यहाँ पे जो भी स्टाफ रहेगा वो वहाँ पे कौन कौन सी ड्रग है, कौन कौन सी मेडिसिन है वो पेशेंट ले रहे हैं, that will be mentioned. This list may be inaccurate or incomplete, particularly in situation where medical staff are overburdened with high patient load. देखिए अगर कोई हॉस्पिटल है तो वहाँ पे इनिशियल स्टेट में कोई भी पेशेंट आया है तो वहाँ पे अगर स्टाफ जो भी है, if he is they are overburdened or they are having the higher load of the patient, so initially what happened? So he will mention he will not go through all the information about the patient. He will mention only important things that is required for the admission of particular patient into the hospital. And especially we can say he will ask about the whatever the medicine the patient is taking currently. So this information that might be inaccurate or we can say that is incomplete. So by speaking personally to the patient about their medication, pharmacist can obtain further information which may be of importance to the ongoing medical management of the patient. So now, what pharmacist he can ask to the patient about the particular medication, and whatever the ongoing medical management that is going on with the patient. So this should be asked by the pharmacist, and this process that is known as a medication history interview. So such a process when the pharmacist is interacting with the patient and he is asking to the patient, so at that time whatever the conversation that is going on and whatever the result that is known as a medication history interview. So this is about the medication history interview. Now importance of the accurate drug history. देखिए यहाँ पे हम पूरी drug history निकाल रहे हैं पेशेंट को. We are asking to the patient about the history of the drug, whatever the drug he has taken. So why it is important? Preventing the prescription error and consequent risk to the patient. Then useful in detecting drug related pathology or changes in clinical sign that may be the result of the drug therapy. जो भी हम drug दे रहे हैं तो उनकी वजह से अगर कोई there is a clinical sign कोई changes हो रहा है या फिर pathologically वहाँ पे कोई changes हो रहा है, so that can be that can be conveyed to the pharmacist, और pharmacist को यहाँ पे पता चल सकेगा कि जो भी result आ रहे हैं उसमें कोई changes है या नहीं है. It should encompasses all currently and recently prescribed drugs, previous adverse drug reaction, including herbal or alternative medicine, and also adherence to therapy for better care plan. देखिए यहाँ पे पूरा जो भी प्रिस्क्राइब ड्रग दी है करंटली या फिर रिसेंटली प्रिस्क्राइब की है मेडिसिन या फिर प्रीवियसली व्हाटएवर द ड्रग दैट हैज बीन गिवन टू द पेशेंट, एंड आल्सो वी आर आस्किंग अबाउट द हर्बल मेडिसिन and also about the alternative medicine if the patient he has taken, and also we can give the suggestion for the adherence to the therapy for the better care plan. मतलब जो भी हम result चाहिए वो result improve करने के लिए we can ask or we can suggest to the patient. So this is the importance we can say of accurate drug history. That's why the accurate drug history that is required in a medication history interview. The goal of medication history interview. The goal of the medication history interview is to obtain a complete and accurate summary of the medication. We are doing one of the summary of the medication that a patient has been using together with the other information which may be useful to contribute to pharmaceutical care. मतलब यहाँ पे पेशेंट को क्योर होने के लिए जो भी दूसरी इंफॉर्मेशन जो भी हेल्पफुल हो सकती है that is required, and we are summarizing it in a medication history interview. So this is one of the goal of the medication history interview. We are summarizing the everything that is taken by the patient and whatever the medication and also some other related information that might be useful to cure the patient. So that we are mentioning over here in a medication history interview, and this is the goal of it. Now the aspect of medication use which may be obtained from a medication history interview. Medication history interview से हमें क्या मतलब कौन सी चीज पता चल सकती है या फिर what we can derive from the medication history interview regarding the medication use. So the first thing we can have the history of previous allergies and any adverse drug reaction, indication, purpose of each medication, then dosing regimen including dose, what was the route, what was the frequency of the drug, and what was the duration of the therapy, then perceived efficacy of each medication and also the perceived side effects, then adherence to medication regimen, then medication administration technique, by which technique the medication that was given to the patient, and use of medication aids. देखिए यहाँ पे अगर कोई patient medication aids कोई use कर रहा है so whether he has used it properly or not, that we can have the understanding about this from the history interview. Then treatment with other system of medicine, again Ayurvedic, Siddha or Unani, any medicine if the patient is taking, then we can have the treatment with the other system whether he is taking other medicine or not. यूज ऑफ प्रिस्क्रिप्शन एंड और नॉन प्रिस्क्रिप्शन मेडिकेशन. देखिए बहुत बार पेशेंट है नॉन प्रिस्क्रिप्शन मेडिकेशन भी यूज कर रहे हैं, so that we can understand from the medication history interview. Then specific problem relating to the medication use. Immunization status. देखिए यहाँ पे कोई वैक्सीन ली है अगर previously, तो that can be included into the again medication history interview. Then possibility of pregnancy in women of childbearing age. Then social drug use. अगर कोई patient he is using alcohol, tobacco or any pan masala, so that can also we can have the knowledge about this, or that can be included into the medication history interview. Then evidence of drug abuse. मतलब कोई illicit product, controlled medicine, अगर patient he is using such a product, then also we can have the evidence about the drug abuse. Then general attitudes towards the illness and medication use. So these are, we can say, these are the aspect of medication use, and that can be obtained from a medication history interview. In interviews, the pharmacist should assess the patient's understanding and attitude toward their medication and health condition. Very calmly, he has to ask to the patient. Throughout the interview, the patient should be encouraged to speak freely, while the interviewer listen carefully and observe. तो यहाँ पे जो भी फार्मासिस्ट है उनको बहुत शांति से लिसन करना है, सुनना है, और वी हैव टू एनकरेज द पेशेंट टू स्पीक फ्रीली. वो शांति से अगर बोल सकते हैं तो यहाँ पे क्या है कि जितना कामली ये काम होगा तो यहाँ पे क्या होगा कि पेशेंट है he will give all the details, or he will remind all the information regarding their medication use. Then following the interview, the data collected should be compared with the medication chart for any discrepancy, and also to identify any drug related problem. If there is any problem, then we can identify from the medication history interview, and for that we can have the information from the medication chart also. मतलब यहाँ पे हम देख सकते हैं पेशेंट ने जो भी ड्रग ली है तो प्रॉपरली ड्रग लिया है या नहीं, that we can determine over here. So these are the common interview process. Now we will see about the medication history interview form. Here I have taken two different sample. We will see first sample, medication history interview form. See, this is the one of the interview form. Here the required information we will see which thing has been included in the form. First one, demographic data, that means patient name, male, female, consultant, who is the doctor, who is the ward number, then admission date, interview date. Now first question, prescribed medication. What medicine are you having at the moment? मतलब अभी कौन सी दवाई आप ले रहे हैं? Record here what the patient says, noting any anomalies with their current prescription. मतलब यहाँ पे कोई अगर ऐसी चीज लग रही है कि भाई ये ऐसा नहीं हो सकता, या फिर ये मेडिकेशन प्रिस्क्राइब नहीं हो सकती. So if any different thing that has been noted by pharmacist, then you have to write over here. Then otherwise they have to give the information about the prescribed medication. Then other drug prescribed previously, मतलब previously जो भी drug ली है with date if possible, what have you had in the past. Then non-prescribed medication, do you take anything that you buy from a shop without a prescription, that means directly from the chemist, health food stores or supermarket directly. That means non-prescribed medication, whether the person is taking, then we have to write over here. If he is taking currently, then we have to mention over here. Used previously, then we have to mention over here. See here the date that is required. If possible, then we have to ask about the date also. Then social drugs, ask what and how much, or how many per week. That means if any person, if any patient is doing smoking, then we have to write over here. If he is taking alcohol, then information about this, how much and how many per week. Then illicit drugs, that means any controlled drug or illegal drug if the patient is using, then we have to mention about the history about the any illicit product over here. Then response to drug therapy, do you think your current medication is benefiting you, मतलब जो भी treatment आप ले रहे तो that is helpful to you. If yes, then we have to write how If no, then why? Then do you think your previous medication benefited you? If yes, which ones and how? And if no, then why? Then do any of the things you buy without a prescription and that help you? मतलब यहाँ पे कोई अगर पेशेंट ने है कोई without a prescription कोई मेडिसिन लिए और that is helpful to him or not, that we have to write over here. Then we have to mention about the side effect. Are you suffering any side effects? Which of your medicine do you think is causing the problem? कौन सी मेडिकेशन आपको प्रॉब्लम कर रही है या फिर साइड इफेक्ट दे रही है? Have you suffered any side effect with previous drug treatment? If yes, then what side effect and with which medicine you have observed such a side effect? Then compliance. How do you remember to take your medication? What do you do when you miss a dose? डोज आप मिस करने पे क्या कर रहे हैं? या फिर कौन सी आप कैसे याद रखेंगे भी आज सुबह लेनी है, शाम को लेनी है मेडिसिन? Then what medicine would you usually take for? मतलब अगर कोई पेशेंट है, if he is taking OTC product, then whether he is taking the product for the headache, pain, flu, allergy, then we have to mention over here. Then who would you ask for medicine for headache, allergy or flu? मतलब यहाँ पे अगर कोई पेशेंट को हेडेक है तो he will ask whether to the pharmacist, relative or friend, nurse, doctor or no one. Then any other problem with the drug therapy, if he is facing any problem with the drug therapy, then we have to mention over here, or any relevant comment that we came to know from the medication history interview, that we should write over here, and on the basis of that any recommendation that is required, then we can mention over here, and afterwards there will be the signature of pharmacist. So this is one of the form that is for the medication history interview. Then another one sample, we can say the another one sample here. Another one sample is there. This is also the same thing are there. Patient information, first name, last name, date of birth, today's date, email. Then reminder preference they have added. That means if you want, if I would like to receive any preventive care and follow-up care, then reminders of such a care. If the patient he want to have the reminder, then he can mention over here yes. Then allergies, patient he is having any allergies, then we have to give that information over here. Then past or present medical condition, अभी currently जो भी medicine condition medical condition है, for example this is very specific compared to the previous form. We are asking over here neurology, endocrine, cardiac, lungs. In cardiac, if the patient is having a heart attack, if previous history is there, then we can mention over here. Then arterial fibrillation, congestive heart failure, high blood pressure, then we can mention over here. Then about this information, that the form in this form, this is mentioned. Then afterwards, diagnostic studies or any test, whether the patient he has gone through the MRI, CT scan, then we that information that should be mentioned over here. Then previous procedure or any surgeries that has been carried out, then that the information regarding the surgery that is mentioned over here. Then social history, again occupational, number of children, marital status, then alcohol use, if the person is using alcohol, beer, then what was the quantity, number, frequency, wine, hard liquor, that should be mentioned over here. Then tobacco, that means the smoking status, that can be mentioned over here. Then drug, the person if he is taking any drug, then again the any controlled drug or illicit product regarding that. Then immunization information. Then family medical history. Okay, this is different thing from the previous form. Family medical history, diagnosis. For example, if the patient's mother, father, sister, brother, daughter, son, grandmother, grandfather, aunt, uncle, if he has suffered from any diagnosis, then that should be mentioned over here. Then current medication, जो भी अभी drug ले रहे हैं, so that should be mentioned over here. Then from which pharmacy the person is taking the product. Then consent to import the medication history. अगर आप ये consent आपको देना है कि medication history, आपकी एक medication history जो भी pharmacy store से आप ले रहे हो वहाँ पे भी रहेगी. So are you giving the consent to this or not? That will be mentioned over here. Then reviews of system, whether the patient he is having any cardiovascular or urinary disease recently, that means currently, if the person he is suffering from this, for example, person is suffering from chest pain, shortness of breath with exercise or palpitation, then psychiatric anxiety, or patient is suffering from the depression, that we have to mention over here. Then review, we can go for the review with the already we have reviewed with the patient, then we can review with the parent, guardian, or if any person is not present with the patient, then we can write over here. So this is one another form you can say, that is regarding the patient medication history interview. So this is over here in this video we studied about the medication review, their goal and significance, then medication order review, goal of MOR, medication order review, then the steps that is involved in MOR, then in MOR that is the one of the part that is the medication history interview, and we have studied about the goal and importance of the medication history interview, and about we studied and we discussed about the medication history interview form. Thank you for watching this video.